Now moving on to our last lightning talk of the day. And for that, I am going to pass over to Adam Harangzo, who is the Wikipedian in residence at the National Institute for Health and Care Research. Over to you, Adam.
Thank you, and thanks for the opportunity. I won't be using slides, but I'll show you some stuff at the end. So I work at the NIHR in a role called Wikipedian in Residence. It focuses on Wikipedia specifically, sharing knowledge about medicine, health, and social care, and updating these articles. Why I think it's especially important to work around medicine is because we know that Wikipedia is really the first place where people go for medical information. These articles on the English Wikipedia are viewed more than 100 million times each month. At the same time, these articles are missing key aspects. They're not necessarily up to date. They're very difficult to read, written in a very academic language, to say the least, and often very US focused. I won't be speaking in detail about my role. I would just like to talk about one aspect, which I hope some of you might find interesting or useful. So my experience is, and possibly of others, is that recruiting researchers as editors can be challenging, and the long-term retention is often unsuccessful. So I'd like to share a method of how you can work with researchers in a way that they can contribute significantly to Wikipedia without learning how to edit it or without having to edit it. Of course, my residency also started with the idea that we should teach people how to edit Wikipedia, and that they're gonna they're gonna have it as a long-term habit, conquering the NIHR for Wikipedia. But issues that I ran into might be familiar to some of you. So organizing a proper editathon requires time, 2-3 hours if we not only want to teach people, but we want them to actually write content. But academics are often busy, overworked, so there's a high chance that they won't do the actual editing, well, even during the workshop, but after the workshop for sure not. At these editathons, everyone often is working on different articles, so the organizer needs to check these separately, and you need to follow a growing number of potential editors to see if they edit and if they're doing okay on Wikipedia, for example, mental health wise. So I think the best case scenario is that people will be adding a few sentences at the end of a paragraph, which might or might not give extra work for other editors. Uh, it might be written in the already mentioned academic language, and if they do become editors, or if they do edit, there's a chance that they will run into conflicts with other editors who might not be nice or remove their work. And this might lead them with a negative experience. So in short, there's a high chance that they won't be editing after an editathon, not in the long run, and they might not get the kind of achievement and joy of successful editing. They will gain an understanding of Wikipedia, but they won't become editors. So how can experts contribute to Wikipedia with their knowledge without requiring them to edit? And with this thing, I'm not saying that we need to give up on academics, or that it's impossible to work with them. I just want to offer a kind of alternative format that focuses on significantly improving medical information without teaching these skills. So really the method is nothing fancy or big, but might help others, and I found it really impactful. So the format is basically what I call a workshop instead of an editathon. It's 1 hour long. It can have up to 20-30 people. Usually we have 10 to 15, no minimum participants. What we do is that all of the participants choose one single shared article that they'll be working on, which corresponds to their expertise. So they're motivated and devoted to work on this topic. The main difference is that we're not working on Wikipedia, but I create a Google document copy of the article. If necessary, I annotate it, add comments, example edits to show them how it's going to look like. So it requires a lot less kind of IT skills from participants. They prepare with the literature to cite their own research, but also whatever is missing from the article. And basically at the event, we have 10-15 minutes of intro, policies, practicalities, what language to use, and then we have 45 minutes of concentrated editing, on this Google document. After the workshop, I usually give them 1 to 2 weeks to continue editing in their own time, maybe involve others from their team who couldn't make it. And after that, I do the editing on Wikipedia. The result of this kind of workshop is usually is that people will learn about why Wikipedia is important for health information, how it works. We end up with lots of new content, thorough rewriting of these articles that treats these articles as a holistic full text and the positive experience of actually contributing to something that matters and doing this as a team. What this might mean for people who want to use this method, so what it might mean to organizers, it means that you have less articles that you need to check, but more content. Uh, at the same time, the resulting text might still be difficult to read. So this kind of thing comes with a lot of editorial tasks. You need to collate all the edits, copy edit the whole article, which you can start during the workshop. And of course, you have to do the actual editing as a Wikipedian. What this comes with is that all the potential conflicts are on the organizer's shoulders. I know that's not very attractive, but hopefully we have more tools to deal with this, and the participants are shielded from these contexts. Also, I'll show you examples of how it looks like, but besides working on this very specific article, so a single article, we can use the new content to actually add to other relevant articles. And so this is really still a gateway to Wikipedia for a researcher. I think it's simple and impactful and doesn't require too much. And of course, you can still offer to teach people how to edit Wikipedia after this, or that's what I do. But then only people who are really, want to use it in the long run will do that. I'll just show you how these Google documents look like. If I can, in a second. So basically, really, you can see this is about head and neck cancer. So this was an already existing article, and you can see the kind of contributions. Here you won't see all the comments because yeah, it puts them to the bottom of the article. But you can see that it's thoroughly rewritten, expanded with the references as comments. Here's quickly another one. This was an eczema and a work in process. This is a new article about the health effects of climate change in the UK. So we have a structure, an initial structure for the article. And this, what you're going to see is the third workshop in a series. So you see my comments, but those are actually other editors. So by the third workshop, we had a very long, I think very good quality article, what we can do. And as a last thing, as I said, you can use these new bits to edit other articles. So for example, what people have written for the head and neck cancer article, I managed to add to all these other relevant articles. So I do feel that this is a kind of simple and impactful way to work with researchers. Thank you very much.
Thanks so much for sharing that, Adam. And yeah, I totally agree. Being able to get expert contributions in this kind of format's really important, and yeah, absolutely wonderful to hear. Thank you so much.